Let's first talk about what frailty is. Frailty is a medical syndrome that's caused by multiple causes that results in a person's physiological decline, making them weaker with time. Frailty is not unlike other chronic illnesses, such as congestive heart failure or COPD. There are times when a person is stronger. There are times where the illness is exacerbated, but ultimately with time, it is progressive, increasing a person's dependency, decreasing their function, and ultimately causing death. And just like chronic illnesses, frailty is associated with multiple symptoms, including pain, shortness of breath, confusion, delirium, incontinence, and even increasing frequency of falls. These symptoms can affect quality of life, not just for the person, but for their family and their caregivers. So let's look at how it applies to MAID. In order to be eligible for MAID, you must have a grievous and irremediable medical condition. And I believe frailty fits that criteria. It is progressive, it is ultimately non-reversible, it is associated with significant symptoms, and it ultimately leads to death. And though we think of specific illnesses as grievous and irremediable, such as congestive heart failure and COPD and neurodegenerative disease, we often don't think of frailty that way because it's not caused by any one thing. But I believe that frailty as a syndrome should be considered grievous and irremediable, and therefore a person with frailty should have the right to request for MAID.